Pinapatay mo yun.
For almost 2 weeks at the start of the zone-wide community quarantine, Baguio City maintained zero COVID-19 cases. But by April 10, Baguio City Mayor Benjamin Magalong had ordered the lockdown of 4 barangays after a couple tested positive. Baguio now has 19 cases and 1 death. Mayor Magalong says Baguio City maintains an effective mass testing and transparency prior to having COVID-19 cases. What are the next steps for the Pine City? We discuss in this episode of The Chiefs. Welcome to the special edition of The Chief. We're still on quarantine. With me is Ed Lingao of One News. Ed, Bok, kumusta dyan?
Are you guys enjoying your home quarantine?
So far, as best as I could, we're being as normal can be in these abnormal times. Pero ikaw, pumapasok ka pa rin sa studio, I see.
Well, I'm now in the newsroom of Channel 5, and we've been updating people on the news. And the big story today is Harry Roque is back in the saddle.
What do you mean?
He's been reappointed as presidential spokesman, effective today.
I see. Okay, so he takes over again as presidential spokesman.
He takes over Bongo's position.
What happens to Sal Panelo? Sal
Panelo is still in the cabinet. He's still the legal counsel. I don't think he ever let go of that position anyway. And yung pagkaka-spokesman ni Sal Panelo naman was really temporary to begin with.
Yes, that's true. Well, in any case, Ed, kasama natin ngayon si Baguio City Mayor Benjamin Magalong. Mayor Magalong, we understand, of course, that like a lot of LGU leaders, you're very busy right now. We know you're interrupting a meeting for us. Maraming salamat po for joining us.
Thank you, Mayor.
Hi Ed, hi Robbie. Good afternoon po sa inyo lahat.
Good afternoon.
Okay, Mayor Magalong, give us the latest update from Baguio, because as we said in the introduction, we're citing Baguio as a highlight, as a bright spot in this, but at the same time, we're not going to discount that this is still a challenge and there are some problems now that you're having to face with. What's the full context would you say for Baguio City right now?
Okay, Robbie, thank you very much. I just would like to clarify, we have a total of 15 cases. We have 5. We still have We have one death because that patient has an underlying condition. She had tuberculosis. We have 9 people that recovered as of yesterday, but today we have an additional 2 people, 67-year-old and another around 45 years old.
Okay.
I just would like to correct you. 3 days ago, we have only one particular positive case. Yung female, yung wife, the husband and the son, 5-year-old son, actually tested negative. So that is just an additional one. So we have a total of 15 positive cases in Baguio.
Okay, so we stand corrected. It's not 19, it's 15. But again, po, all in all, people will hear that and they will say, okay, that sounds like sounds like a good thing. But from the perspective of a mayor na kailangan po pangalagaan ng napakaraming tao, how exactly would you put your frame of mind right now?
Yung 13 days, we were really looking forward to a flattening of the curve. But as I've said, you can never predict this kind of disease. It will always show up one way or the other. So the challenge here is to really keep tight your borders. At the same time, you have a really tight surveillance and monitoring system that should be very effective. And that's the reason why we're working now on a mass testing using rapid test kits. Kasi hindi naman readily available yung Department of Health kits. Kasi while they always says that they have enough test kits, again, they are lacking reagents. In fact, I just talked to our BJ's director and sinabi niya sa akin and lately, sir, we have enough test kits.
Yes.
We only have 5 days supply of reagent. So yun na naman ang challenge. That's why we cannot do away with rapid test kit despite the fact that there are a lot of oppositions. We are working on the test kits right now. And because of that, dito namin na-detect yung several positive cases using this rapid test kit. These are not confirmatory tests, but after determining that they are positive, presumptively positive, then we subject them to this DOH test kit. And in fact, today,
I think Mayor Magalong,
parang nag-freeze yata ang signal. Ni Mayor Magalong.
Pero interesting, Robbie, yung case ng Baguio City is interesting kasi they had only 15 cases na confirmed out of 345,000 population. So that's relatively small. And considering na Baguio is a tourist destination, talaga it makes its money out of people coming in from outside, which is of course a bigger risk for any LGU. So 15, I suppose, is really manageable, especially.
I wanted to ask nga, when Mayor Magalong comes back, that's actually one of my questions, because there's 2 ways of looking at that, di ba? And on the one hand, you would think, okay, daming parating dinadagsa ang Baguio. On the other hand, also, one peculiar thing about Baguio is he was talking about controlling your borders. That's a relatively easy area to close off from everybody else.
Ilan lang highway mo Pag sinarado mo highway, di ba pag nagsasarap, pag nagla-landslide nga, wala naman.
You have Marcos, Nagilian, and
tapos yung going up north na.
Exactly. Madalas, and we're very familiar with that. Madalas kami dyan. My wife, as you know, si Joy is from Baguio. Their family is from Baguio. So alam namin yung access dyan. And going to your point, alam din namin how easy it is, whether deliberately or by nature, to close off access to Baguio.
And si Mayor's back.
Mayor Magalong, naputol po kayo. But before we get into your interventions, including the rapid testing, we think a lot of people would be interested in that. But habang wala po kayo kanina, Ed and I were discussing the peculiar situation of Baguio. Para lang may full context po tayo, how easy or how hard was it to close and to limit your own borders?
Tayo daw narinig nila sa ito.
Okay.
Mayor, can you hear us,
Ed,
Mayor?
mukhang may... Okay.
Mayor, can you hear us? Mayor Magalong, dinig niyo kami? Mayor, dinig niyo po kami? Mukhang matindi yung lockdown ni Mayor. Pati tingin ko hindi makapasok.
Hindi okay.
Sorry, we'll try to get a better signal for Mayor Magalong in a while. But in the meantime, interesting sabi niya, rapid test kits ang ginagamit nila, which and he acknowledges this, which would need confirmatory testing pa rin. Pero it's a good way of at least first screening but it's not final screening
Yeah.
So,
but as you know, di ba, parang when you hear rapid test or any kind of test, the question always on people's minds is, bakit doon kaya, sa iba hindi? Or, di ba? Or for that matter, how did they source it? Where did they source it? And what makes their access to that, never mind the strategy, but even the access to it, what makes it different for them? I mean, these are the kinds of questions that we really want to understand with Baguio City.
Tapos may binabanggit pa siya na na CAT scan testing, which is an entirely different thing altogether from the RT yung PCR, RT-PCR testing. So iba pa 'yon. So he has this hybrid of test kits.
But Ed, while we're waiting for Mayor Magalong, dovetailing into the news about Harry Roque being back as a spokesperson for government and for the president specifically, meron na ba siyang pauna na binalita?
Wala pa.
May pauna na ba siya binalita as spokesman?
What we understand, as of 12 noon today, sabi ni Harry Roque, he is still in an event in Binyan, but from that event he will be heading straight to Malacanang to take over the helm of to take over the position of presidential spokesman beginning this afternoon. So by late this afternoon, we'd probably have word from Harry Roque as presidential spokesman na.
Okay. Now, it's in the meantime, whether it's from Harry Roque or anybody from government, what are you expecting today? It's another Monday. Happy Easter, by the way, Ed. It's another Monday. It should be time for another weekly report from government. We should be anticipating, ideally, had we not extended the ECQ, we should be anticipating some sort of an adjustment at this point. But notwithstanding the extension, what are you expecting from government today, whether it's an address from government or latest updates?
Well, what we had already a while ago, this morning from Secretary Carlo Nograles was the figure of 45 billion being released already to the special or the social amelioration fund through the SAC. So that's roughly half of the budget for the first month, which is 100 billion. That's already been released to several targeted families. Ang di lang tayo clear kasi wala pa siya binabanggit. How many families are we talking about here? They've released half of the money to the LGUs, but they haven't told us yet as to how many families have received this amount. Kasi the target nga is 18 million families. That's around 75% of 24 million families nationwide. So if you go by the ratios, and if everything is constant, maaring 8 million families ang nabigyan kung kalahati talaga. But those are assumptions.
Exactly. Assumptions. And those are precisely the kinds of details that we're anticipating. I'm also curious, only because ikaw may access ka sa newsroom natin, I think there was some kind of a statement of this in the past. But it's April, what is it now? It's
April 12. Yes,
April 12?
13, sorry. April 13.
So by this time, we're talking about deadlines in taxes. Ano bang latest update natin on the...
my understanding was it was extended for a month. Teka, I have to check that out. I forgot about that. But my last word on that.
Find out, Ed, pagka nakuha mo na yung letter mo from the BIR.
Well, the last word I got on that was that there was an extension of a month by the BIR on the ITR's filing. But that was last week. Eh.
Oh,
Let me see. Yeah, BIR extends deadline for income tax filing from April 15 to May. Wait, medyo mabagal ng loading. But to sometime next month. Ito. To May 15, 1 month. Yeah. That's a
and that was
BIR.
was that announced in the same occasion and context of the announcement of the extension of the ECQ, or was that announced prior to the extension in the ECQ?
I don't really recall it. This is March 20, dated March 20, and this was by Commissioner Dulay himself. So it was not Carlo Nograles who made the announcement. Eh. It's a
Hmm.
revenue memorandum circular 28-2020 dated March 18, signed by Commissioner Cesar Dulay, extending the
Hmm.
filing from April 15 to May 15. Not really sure na kung it was timed with the extension. I don't recall anymore the extension.
Well, if it was March 20, then that was announced before the announcement of the extension. So again, I don't know. I'm not holding out hope either way.
Mm.
I guess my question just comes from what I think might be at the
Mhm.
back of their minds of a lot of people right now, because certainly, usually around this time, this is where people are scrambling, trying to beat deadlines, and so on.
Okay, Robbie, I've just been advised that we should go into a gap for a few minutes, so we will be right back. So please stay with us.
Hindi, okay lang. Hindi naman yung official.
Pwede mo sabi yan.
Hindi, baka makita tayo sa ano eh. Sorry, baka makita kayo sa ano Naka-stream tayo sa FB.
Check ko na ngayon, sir. Hindi tayo kita.
Sa FB, hindi tayo kita?
Naka-block po. Quarantine na doon.
Na mag-order. Pero ikaw,
Ed? Robbie?
Yes.
Kasi wala siya nung wala siya nitong private chat na to eh. Pero ikaw, Robbie, meron ka eh. Diyan kayo bibigay ng instruction.
Babalik ko po.
Ano?
Dito sa may private chat sa tabi mo, wala niyan si Ed. Ito lang ang meron niyan, Robbie. So kailangan din, ikaw ang bangka ngayon, dito ka namin bibigyan ng instruction, ha? Bulag si Ed siya, hindi kita yan. Okay, so patest po si Benji Magalong. Patest po si Sir Benji.
Mayor Benji, are you back? Are you back with us? Hello? Mayor Magalong?
I don't think he hears.
Wala, no video either.
Bok, kung ganyan Bok, mag-phone na lang tayo kasi yung may video tapos yung naintindihan. Tapos putol-putol tayo.
Oo. Kaya ba? Phone patch na lang.
Woo! Sir, Mayor Magalong, can you hear us? Mayor Magalong? Mayor Magalong, can you hear us? Mayor Magalong, can you hear us? Wala tabok?
Yeah. See, Susie, what's the earliest that Susie can get on board? Yeah. What do you mean? Okay, kwentuhan na lang. Where's JC? Anong kinocover ni JC? Okay. Ano yung quarantine area? Okay. But what do you mean quarantine area? Luzon Luzon in general, nag-iikot siya in the field?
Uling na, bunso. Pinapadownload ko na yun. Sige, okay lang. Meron ko sa T. O sige,
Ano nga apelido ni Mayan? Los Baños. Okay, thank you. Okay, thank you. So nasa siya right now? Okay. So sino una? Si JC or si Mayan? Okay. Bye.
Dito na kaya? Dito na. Kaya ba kayo sa labas ngayon?
Lalabas ka.
Oo. Kaya ba? O dito na lang sa sasakyan? Dito na lang. Tama ko na lang.
Yes. Hinaan mo na lang. Kasi hindi ka naman marinig yung pag pinuli pa. Kahit mahina lang siguro, pang video support lang.
Okay, ready? Okay, welcome back to the Chiefs. We apologize for the technical difficulties. mukhang hindi po tayo makabalik kay Baguio Mayor Benjamin Magalong. But in the meantime, let's talk about places where you cannot go right now, given the quarantine. We still have News 5 correspondents roaming the quarantine areas. In particular, we have JC Cosico joining us. JC, nasa ka ba po?
Robbie, actually right now we're on our way to the Ninoy Aquino Stadium sa mga oras na ito. And pero kanina ay nag-inspection nga itong mga government officials, kasama na nga dyan si DOH Chief Duque sa National Task Force Against COVID-19, Chief Implementer Carlito Galvez at iba pa. Dito nga yan sa Ninoy Aquino Stadium na ngayong hapon inaasahan na darating na yung first na COVID positive patients dito nga sa facility. Yung buong facility, they can house around the 112 na patients. Na again, yung nila lamang i-cater ay yung mga mild at asymptomatic COVID-19 patients. Now, each patient will have their own cubicle. Meron silang sariling kama, may side table, merong nurse call, and they're also given a free food and internet access habang andun sila sa facility, habang silang yung nagpapagaling. So, ngayong habang nga ating inaasahan again, yung first 3 patients ay ma-admit na rin. Robbie.
Okay, now JC, ulitin lang natin, no? Medyo choppy lang in some parts, but we understand what you're saying. In particular, sa Ninoy Aquino Stadium, this is in Pasay, if I'm not mistaken, convert into a facility that can accommodate patients. Now, you were qualifying anong cases lang? Mild to moderate cases lang? Did I get that correctly? And also, are there specific referral hospitals from which the patients will be coming from? Or kung saan man manggagaling itong mga to?
Yes, Robbie, ang sinasabi ng DOH, yung ipapasok lamang dito sa kanilang mga facilities, apart from the Ninoy Aquino Stadium here in Manila, ay yung mga mild at asymptomatic COVID-19 patients. Because the goal of these facilities ay para ma-decongest nga yung mga hospitals. Kasi yung mga hospitals, this will only cater yung mga severe patients. Para nga, ito kasi yung mga hospital na may mga facilities. For example, yung mga patients na hindi intubate, doon sila i-cater sa mga hospital na yan. Now, doon sa pinabanggit ko sito na doon naman sa saan manggagaling itong patients na ito, hindi pa dinisclose sa atin kung saan yung mga patients na ito dito sa Maynila.
Okay, but I guess JC, a quick question lang, and I guess Ed will have questions for you. But quick clarification lang, yung mga papadala dyan sa Ninoy Aquino Stadium, for example, will have to be triaged and then referred by the hospitals. This is not a walk-in center. I mean, we're talking about not overwhelming our facilities. Pagdating sa facility ito, let's manage expectations as well. Can people just go there on their own or kailangan rini-refer dito ng mga ospital?
Yes, Robbie, ang sinabi ng DOH doon sa kanilang last na inspection dito, talagang referral system yung mangyayari. So, itong tatlong patients ito ay referred ng Manila Health Department, but we are not sure kung saang ospital dito sa Maynila galing itong mga ito. But again, referral yung system yung mangyayari once or yung matransfer nga yung mga dito. Robbie, rather.
Well, JC, let me just locate, yung Ninoy Aquino Stadium is inside the Rizal Memorial Complex. Now, that's a complex that's just behind a school and near what used to be a shopping mall, and it's also near a hotel. In other words, kahit pa paano, it's a pretty congested area. Now, for the benefit lang of our viewers, na baka may mga concerns na they're going to house people who are positive there. Tell us about the precautions being undertaken. Tell us if there is any danger to people who are outside of the compound, outside of the complex. Is there any danger of transmission at all?
Bok, ang sinasabi naman ng DOH, there will be safety protocols in place doon sa kanilang mga facilities, and this will be in accordance to the WHO standards. With regards to your question, no, doon sa mga nakatira dito sa malapit sa facility, ay talagang meron namang restricted access. Hindi basta-basta makakapasok ang kahit na sino dito sa facility na ito para nga ma-ensure na hindi talaga kakalat itong virus na ito. Bok.
So huwag kayo mag-alala kahit nasa Liberisa kayo, nasa Quirino kayo, nasa Taft Avenue kayo, hindi basta-basta kakalat yan so long as nobody tries to breach the facility and I suppose man well-guarded man yung area.
Yes, Bok. Mga sundalo yung mga nagbabantay dito sa facility. And i-add ko lamang no, yung mga medical staff na ma-assign dito ay mula sa AFP. But as to the number, we are not yet sure kung ilan sila. Pero just in case naman daw na kulangin yung mga medical staff. Kasi again, these are 112 patients. No? Kung sakali naman na magkulang yung mga medical staff mula sa AFP, ay meron naman silang mga, o yung DOH, ay nakahandang mag-augment ng kanilang puwersa. Bok.
Bok, one more question before I pass you on to Robbie. Itong area nito, itong Ninoy Aquino Stadium is for people nga, sabi mo, with mild symptoms or asymptomatic. So, ibig sabihin, yung mga people with critical or serious symptoms, talagang doon lang sila sa hospital where they will get the ultimate in medical attention. Ito mga nandito sa mga off-site, if you might call it that, mga off-site quarantine areas, ito yung mga hindi gaanong delikado at hindi masyadong malubha ang karamdaman, kaya sila off-site.
Yes, Bok. Ayun yung ulit na sinasabi nga ng DOH na only mild and asymptomatic COVID-19 patients. Pero in the event na maging critical yung kondisyon, maging severe yung kondisyon ng mga pasyente while under quarantine dito nga sa facilities na ito, ay ililipat naman sila sa mga ospital.
Okay, JC, as we said, parang may patutunguhan ka ngayon. Alam natin nag-i-inspection ngayon ng gobyerno. Let's talk about ilang facilities ba to? I mean, as we can track right now, how many facilities are being readied precisely to try to decongest our hospitals, other areas that are being converted and repurposed? Give us an idea of everything that's going on in the quarantine areas.
Yes, Robbie, apart from the Rizal Memorial Stadium, itong Pineda Stadium sa Manila, ay inihahanda na nga rin ang pamahalaan itong World Trade Center in Pasay City and itong PICC in Subic, Pasay. Now, the PICC Quarantine Center can accommodate around 300 patients and habang ito namang facility sa World Trade Center can house around 502 patients. Now, inaasahan natin na yung target for the World Trade Center and sa PICC ay last week. Now, it's a new week. Ang sinabi ng DOH kanina, bakit man samantala na-delay, for example, itong sa Ninoy Aquino Stadium, ay meron pa silang ilang mga pinlansya. For example, kaya bahagyang naantala. So we are expecting na in the coming days na maging operational na nga itong mga facilities na ito, yung World Trade Center at saka itong ICC. And the government as well is also eyeing other quarantine sites, katulad ng dyan yung Philippine Arena sa Baguio, Bulacan, and yung full investments sa Matin Bukasin. Robbie.
JC, give us an idea also when we talk about not wanting to overwhelm our health facilities. At the same time, we're starting to decongest the health facilities. Pero anong itsura sa mga ospital? Nakakapagronda ka, nakikita mo rin, not necessarily inside, but certainly outside. Pero ano bang eksena ngayon sa mga ospital, sa mga nakikita mo?
Yes, Robbie, hindi naman tayo talaga really nakakapasok sa mga hospital, but we're hearing reports, stories na may ilan talagang hospital na hindi na tumatanggap ng mga COVID dito. Now, again, ito nga yung paraan ng pamahalaan para nga ma-test yung hospital kasi nga these intended for a severe case.
Okay, now JC, not necessarily related to COVID, although this will have something to do with the information that we'll be getting. Binalita mo kanina, Harry Roque is back as spokesperson of the President and of Malacanang. Do we read anything more into this, or do we just take it as face value? Anong nangyari?
Yes, Bobby, bigla na lang ito binanggit ni Senator Bongo kanina doon sa ating
Ino-play ko na lang
the inspection. And actually, we have more details into it. Pero sinasabi niya itong Secretary Panelo still as the legal.
Yeah, si JC is getting a bit choppy eh. I'm wondering, nakikita mo yung likod ni JC, mukhang malakas ang ulan ngayon ah.
Oo nga hindi umuulan ba? I know just sa studio, it's hard to tell from outside.
Yeah.
Dito sa Quezon City, sa Tandansora where I am, medyo makulimlim at actually naamoy ko yung simoy na hangin ngayong nabanggit mo. Napapansin ko nga na mukhang hindi naman malakas. May ambon sa labas. Tsaka ngayon naamoy ko yung simoy na hangin. Medyo lumamig ng konti. Mukhang medyo umaambon.
I'm wondering lang, JC, because you've been covering a lot of these health issues, especially itong COVID-19. I don't know, has the health department ever talked about the effect ng weather, whether it's heat or rain, doon sa sitwasyon natin?
Yes, Bok, no. Ilang beses na yung natanong sa mga press briefing ng DOH kung talagang may papel ba yung panahon. Pag ba talagang mainit, panahon ay magsisibig na virus. Kasi sinasabi ng DOH, wala pang sapat na pag-aaral on that. Kung talagang pag mainit yung panahon, pag summer season na namamatay ang virus, wala pang sapat na ebidensya daw on that.
Kasi Indonesia may problema rin sa COVID-19 kahit mainit eh. Also in Africa. Diba? So I suppose the jury is still out on that. And also by that standard nga, how much heat would you need in the weather to kill a virus effectively? It's not just because mainit yung panahon, ibig sabihin patay yung virus. I think people should disabuse themselves of that idea na gano'n kasimple.
Hindi lang
Yes,
yun. Ako,
Bok.
Jay, ang tanong ko, gaya nga nabanggit ni Bok na matagal ka na rin nagko-cover ng mga health-related issues. Kahit tanggalin mo yung COVID, given the quarantine at nakakulog ang mga tao ngayon sa kanilang mga bahay, sa kanilang mga communities, given the situation, even outside of COVID, what do the rains usually bring in terms of health concerns for communities?
Tingin ko, Bok, hindi ka narinig.
Parang hindi ako narinig. Sige, anyway, we need to take a break. Babalikan natin mamaya kung may opportunity, but we need to take a break. Ed, please stay right there. The Chiefs will be right back.
Paod, Doc Susie, game na po tayo.
Okay. You want the camera on?
Doc Susie, yung video mo po. Ayan, okay na po.
Hi, Susie.
Hi.
Hi, ma'am. Yun, magandang signal nyo.
Oh, yeah.
Nahirapan kami kay Mayor Magalong eh.
Oh, okay.
Susie, tapos na ang iyong telecon with your turtle pond.
Yeah, tapos na. Very interesting. So I'll try to write it all up tonight.
Sige.
Are we coming in?
Welcome back, the Chiefs, here on One News in this special quarantine edition once again. Joining us in this conversation is Dr. Susie Pineda-Mercado, one of our favorite public health experts, always on this program, always on the Chiefs, always on One News. Susie Pineda-Mercado is the President's Special Envoy on Public Health concerns. Susie, welcome back. And it's April 13. 2 weeks ago, people were saying, okay, April 14, we can start expecting some sort of an adjustment to this abnormal situation. As we all know, it's been extended to April 30 at the very least. But whether it was supposed to be yesterday or whether it's April 30, what can people or what should people expect on how this lid is going to be lifted from all of us? Nobody's expecting a full lifting of the ECQ, but what will a partial lifting look like, do you think?
Okay, so I think first of all, we have to expect within the next 2 weeks, that you're going to see increases in cases. So you see the numbers grow. It's highly likely we'll have more deaths. And this is all residual. These are all infections that occurred prior to the community quarantine. Okay, so now the real challenge here is the ability and the capability of every local government to be able to identify could be through testing or just looking at anyone who has symptoms, isolate people who are sick. If we do this properly in the next weeks, what we can expect with a lifting or a gentle or modified community quarantine would probably be the return of certain services and industry should be able to function already. And based on what some economists are saying, start looking at the supply chain of essential goods like food, medicines, and other things, and protect those workers. So one of the things we're toying around with is the idea of, can we provide these workers or the modification of the lockdown or the quarantine with some form of personal protective equipment, which is industrial in nature. So it's not necessarily a PPE of doctors and health workers, but maybe modified face shields, maybe some kind of modified raincoat, boots, etc. for people who are in the agriculture and the industrial sector. Plus, when you get to the offices, as much as possible, you maintain a work from home, social distancing, and so on. Because this virus is not going to go away. It's going to be with us, and we're going to need to learn how to live and cope with it, and to minimize infection once we lift or modify the enhanced community quarantine.
But Doc Susie, to what degree? I mean, assuming that we do give them these modified PPEs, to what degree should we allow the return to normalcy of industries or of the workforce? For example, si Teresita C. Coson was proposing 50% of the workforce go back to work. Yung consumption industries, there was an internal memo proposing a return of all industries except for the malls. Kayo po, to what degree po are you looking at?
I mean, I think it's very difficult to give a percentage, like what's the percentage of return. Again, as I said, if we follow a supply chain framework for food, medicines, and essential goods, then you want to restore that particular sector possibly to 100%. But you want to restore them to that to functioning, but you want to protect them at the same time. That's what I'm saying. Maybe we have to think about how we get them to work, but give them some form of additional protection that does not compete with the PPEs of the health industry. So I would say, from a public health point of view, I would say maybe let the LGUs decide if they're ready to lift their enhanced community quarantine, because they know And I would say that the public health parameter for them would be, are they really able to say that they can identify, either identify because of symptoms or identify through testing, and quarantine people who are sick? Because we will have to continue to do that even after this enhanced community quarantine is lifted. And that should be the same in industries. If somebody gets sick, has a cough or a fever, you have to vet them. You need to isolate them. You need to take care of them. So the preparedness is not something that's going to need to cut across all of the industries as well, especially those
Mhm.
we think should go back to full functioning. I would say would be food, medicine, and essential goods.
Mhm. Mhm. Mhm.
Okay, but
So may
Susie,
selective sectors na
you were
100%.
talking about the readiness of LGUs and you leaving it to them. But in reality and in all practicality, let's say just to take Metro Manila with various LGUs. Sabay-sabay ba ang pag-lift niyan or ang pag-adjust? Or is it realistic to expect na hindi? An LGU in the north and then an LGU in the south will by their own lift it. In reality, if we're all transient members across different LGUs, we will have to cross borders from Quezon City to San Juan to Mandaluyong to Makati and so on. Is there a practical way to envision how that will happen kung hiwa-hiwalay or sabay-sabay?
Well, ideally, right? Ideally, if we could, I would say that you still keep people who live within a city within that city for maybe another 2 weeks
Hmm.
until you're ready to open up all of NCR. But then no one in and out of NCR, because remember we are the hot zone. Now everybody in Metro Manila who has any kind of symptom, we classify that as suspected COVID already. So I would say maybe for 2 weeks or so, let people work only within their city and try to do work from home, etc. Bring back some level of normalcy so people can go out, stores that have direct entrances can open, at yet the malls, and so on, so that there is already some change going on, because we cannot continue to be in this
Yeah.
state. I mean,
Yeah, I
is
mean, yeah.
we can't continue.
And Susie, to illustrate how complicated this is going to be, kasama natin sa linya si Gerard de la Peña. And from what I understand, nasa linya siya ng mga pumipila to get their benefits or ayuda under the current ECQ. And even here, just by mentioning that people are in line to get their benefits under the ECQ, immediately, ang daming gusto naming tanungin. Let's bring in Gerard de la Pena. Gerard, where are you exactly and ano exactly ang eksenang tinutuntungan mo? Gerard?
No, wala tang audio si Gerard.
Nako, hindi natin marinig.
Si
But anyway, let's
Ge-
go back to...
Pero
yeah.
Bok, si Gerard si Gerard nag-cover din kanina dun sa sa elliptical circle, may mahabang pila ng mga driver ng jeep tsaka bus na kumukuha ng kanilang 5 to 8,000 pesos na parang relief for their failure to fly the routes. So they're going to the land bank. So you look at 200,000 an industry of 200,000 drivers who now have to line up sa land bank to get the relief.
Oh, hindi lang yun.
And
Di
hindi
ba,
to
Susie,
ATM,
we were-
hindi to ATM.
Oh,
Over the counter to.
Yeah, hindi lang yun, Bok. We're talking about trying to normalize the supply chain. Yesterday, may nag-viral na pictures supposedly from Balitawak. I have no idea if those are legitimate or fake pictures or mali ang context. But the thing is, it does bring up the question of once you loosen and hopefully make efficient the supply chains for food, for example, and supplies, you should be expecting, and we are expecting, more and more people going to the markets and so on. So Susie, again, going back to the practicalities and the complications, what else are you expecting? At least, if not the answer, what are the questions we should be asking ahead of trying to bring about at least a partial lifting of the ECQ?
Okay, so I mean, at the end of the day, this is a question of our being able to accept that COVID-19 is going to be part of our lives. That we're going to have people getting infected and people dying from it. Hopefully, this quarantine has slowed down the spread, and that slowing down should teach us to change the way we live and the way we work. Now that's easier said than done, no? Kasi sometimes people don't realize how serious a disease is until somebody actually gets sick. And I think for the most part, ordinary people feel like, well, buti nang magkaroon tayo ng pagkain, magkaroon tayo ng hanap buhay dahil nagkakasakit lang din naman tayo eh. So, we started this, when this pandemic started, there was already great inequity. You already have a lot of people with so much illness that the health system cannot handle. So, we have to ask ourselves, one, how ready are we to handle an additional burden of infections? Some of the conversations we're having are like this, right? If somebody comes in with a motorcycle injury, what do you do in the emergency room? You have to handle that patient if that patient is a COVID patient because it's in Metro Manila. So how ready are we to do all of that? My surgeon colleagues are saying that for them, every surgical patient is a COVID patient. So they triple their PPE. So this is the thing, no? We are going to have to live with this. We're going to have to live with it. And we have to get better at it. Unfortunately, it takes a long time for health systems to change, and this might accelerate it. But I think the question for us is, are we ready for that trade-off? Are we ready to see people, continuously in hospitals getting sick of COVID? Are we ready for that? Because that's going to happen. That's going to happen. Now, it's not going to be exponential or huge numbers, but it's going to happen if we do not put in place measures for social distancing, hand washing, use of masks, and as I said, personal protective equipment for people who are selling things, who are in manufacturing, who are in other sectors in the supply chain.
Doc Susie, if I may, I remember a month ago or thereabouts, the model that was being looked at, yung pre-enhanced quarantine model, the estimate was around 65 to 75,000 infected Filipinos in 2 to 3 months. But that was pre-enhanced quarantine model. I'm wondering, since we've been in enhanced quarantine for 1 month already, I'm assuming that there's been a new model developed already by either the DOH or the NIH. What numbers are we looking at now with the enhanced quarantine in place?
Well, I always look at the death. I always look at the number of deaths because your deaths represent something like 5% of the total number of people who are infected. Now, again, that varies from place to place because in some places you might have better capability of saving lives than others you don't. As a rough estimate, I actually look at that because the number of cases that are positive, remember that's cumulative since February, right? And that's has a delay. It's got a time lag because when you have a test done, it takes you about, laboratory test takes 5 to 7 days before you get the results. So there's a time lag there. So what are the actual numbers? It's hard to say what the actual numbers are, but I would say that what you see as the number now is probably the number of people who got sick 2 or 3 weeks ago. So it will still go up a little bit. And hopefully, if we relax the enhanced community quarantine, if local governments are able to enforce still social distancing, if industries do it, offices do it, and so on, then we can still minimize transmission. Minimize transmission.
Well, Susie, a quick question lang on the numbers that people are looking at. Could you expound on recovery rate? Because that's something that certainly on social media, I see a lot of people asking questions. Okay, di namin alam kung mataas o mababa yung death rate and so on. Ito yung absolute numbers in terms of confirmed cases. But yung sa recovery rate, para ang ano ng mga tao, pagka kinumpare natin sa ibang bansa, parang ang baba ng recovery rate. What's the proper way of looking at that and contextualizing at least the numbers that we see on recovery rate?
Well, the thing about recovery rate, Robbie, is it is dependent on an exit test. So in order to say that the person has moved from positive to negative, you need to do a swab test again. And
Yeah.
that swab test takes another 5 days. What we do know is that 80% of people who will get this disease are going to get a mild disease. And many of them are not even going to get this. So we're looking at one highly infectious disease. Second, one that we don't know. Like we don't know what if you get immunity from getting the disease, we still don't know that. And then we don't know what to measure in sort of saying that you already have neutralized the virus in your body. Wala pa rin yan eh. Marami tayong hindi alam. So the recovery rate is an indication of people who were tested positive and then tested negative. And so in both of those, you have a lag time of about 14 days, right? 7 days,
I
7
see.
days. So I would say the other number to watch would be the number of hospitalized patients, because that will tell you those who are developing moderate or severe disease, and that should represent about 20% of the total of those who are infected.
I see. So you try to track the number of people who are getting hospitalized without necessarily conforming. So you're making a presumption that these are people that are so they're presumed to be positive. That's the more constructive way of looking at it. And then if you apply the ratio of 20%, then you multiply by 5, and you have a general idea of ilan talaga ang infected.
Yes. Yeah, that's the only way. Those are the only two reliable indicators right now. Until we get to a point where you have real-time reporting of testing, which no country has been able to do. Because the laboratory requirement, at least, right, if we were at full efficiency, should be 2 or 3 days. But currently, it's 5 to 7 days before you get any kind of a result. So we don't have real-time numbers, but you do have real-time death, and you do have real-time hospitalization.
I see.
Ma'am, I'm sure you've heard this several times already being asked of you. Let me just take a stab at this. There was one journal of the CDC. I think it was the Emerging Infectious Diseases Journal ng CDC, published a preliminary study by a Chinese group that seemed to show that the virus would stay airborne in certain conditions for several hours, and it can reach up to 4 meters or up to 12 to 13 feet, not just the 2 meters that we previously thought of before. That used to be our safety margin before, in 2 meters. What do you think of this? I of course, I understand it's preliminary, but does it raise concerns about the strength of this virus and the infectiousness of the virus?
Well, definitely. Like I think 3 weeks ago or 4 weeks ago, we already knew that there were certain procedures you could do in a hospital that the verb that they use is aerosolized. No,
yeah,
it means that the droplets coming out of the nose or the mouth get blown into the air and are somehow suspended there for some period of time, and that's the reason why you have a lot of doctors who have died, because they've been exposed to that. Now, so even if they're in PPE and so on, maybe a patient leaves the room and it could be that there's still some virus in the air in the form of an aerosol. So that's why you have really a very unfortunate and tragic infection rate among health workers. Now, the procedures, of course, are quite invasive. So, intubation, for example, can make the patient gag and cough. So, coughing, right, and all of that's blowing into the face of the frontline worker. They say that even the nasal cannula, that tube that you put through your nose, or an oxygen mask, anything that has force or pressure will push the virus into
Oh
the
yeah.
air.
Yes.
So in that case, in that sense, in enclosed settings like hospitals, and we saw this in the early studies coming out of Wuhan, that you had patients who were in the hospital who got infected. So they were not COVID patients; they were there for something else, but they got infected. So the hospital setting is in fact very very high risk for transmission of disease. Now, what does that mean in terms of this 4 meters and 12 to 13 feet? Again, in the early days, what we were told was that it was droplet spread. If you're
Mhm.
like, 6 feet away, you're okay, right? But
Yeah.
now seeing there are micro droplets and they can still spread. So how much that is the reason for transmission or how much that is the driver of infection, we don't know, right? We don't know. But the fact that they're able to do this documentation means that we have to be really careful, and that's why the advice for everyone to wear face masks, and that will have to go on. Even if the quarantine is lifted, we'll have to be in face masks, and for workers, I would say maybe to be in face shields. I don't know.
Mm. Mm.
Okay, now
Although to be
Susie,
fair,
again,
to be fair to the people who wrote the study, they also did point out that it's a preliminary study, and pangalawa, they said that they are not certain yet if the aerosolized virus particles would have the amount that would have caused an infection. So wala pa
Right.
sila dun sa bahaging
Yeah.
yun.
okay. Now, Bok, Susie, again, I think we have Gerard de la Peña back with us. And gusto ko lang ibalik nga yung eksenang nakikita ni Gerard with regards to yung mga people na nakapila para makuha yung because I think this might inform the irony of what we're trying to talk about here. Gerard, where are you exactly? Hello?
Baka
Right
wala
now,
siya.
nandito na ako sa Mandaluyong, pero kanina, nag-ikot-ikot tayo dyan sa bandang Quezon City to check yung situation doon. And nagpunta tayo doon sa may land bank sa Elliptical Road, and we also went doon sa land bank branch doon sa Muñoz, and we've seen na talagang napakahaba ng pila. Like for example, yung land bank doon sa Elliptical Road na katabi ng Department of Agriculture, yung pila nila ay umabot na ng lampas ng PTV4 offices. So ganong kadami yung mga nakapila kanina. And napansin wrong practices na ginagawa nila doon, parang nakalimutan na nila yung social distancing. And sana siguro dapat nakapag-prepare din yung land bank and yung LTFRB ng mga masisilungan or maupuan man lang ng mga drivers na magki-claim ng kanilang subsidy doon sa land bank.
Hey, Gerard, could you paint a clearer and more detailed picture of us for us when you say na parang nakakalimutan na yung social distancing? Dalawa kasi yan, di ba? Haba ng pila at saka dami ng tao. Actually, tatlo pa nga. Yung pagkasiksik ng mga pila. No? Could you be more detailed sa nakita mo?
Yung when we say kasi nagkakaroon ng social distancing, proper social distancing, ito yung makikita natin ng mga pila sa mga supermarkets right now na talagang 1 meter or even 6 feet apart ang mga nakapila at namimili at talagang nakaupo sila sa mga silya. Itong mga drivers na nakita natin kanina dun sa land bank branches, napansin natin na parang ordinaryong pila lang na talagang magkakadikit sila. Yung iba walang mga masks, yung iba parang it's like an ordinary day for them na wala tayong iniinda na epidemic or a pandemic like what we are experiencing right now.
Yeah,
So
Gerard, very quickly, wala ka nakitang marshal? Sino nagma-marshal? Sinong tumatanod dun sa pila? Wala bang pulis? Wala mga tanod? Nobody trying to marshal the people?
Well, may nakita tayo mga taga PNP doon na naka-megaphone pa sila, to tell the people na sila ay dapat i-observe pa rin social distancing. Pero I think bukod sa kulang din yung PNP personnel natin, talagang dapat siguro i-enforce itong social distancing at dapat mas stricto sila sa implementation doon, which is hindi natin nakita kanina.
Kasi
Okay.
delikado yan eh. Mga jeepney driver yan eh. Pag may mahawa dyan, ang isang jeepney driver, ang sakay niyan, kung bumalik sa trabaho yan, 12 tao.
And now, Susie, let's bring it back to the big picture that you're trying to discuss, but inevitably we go to the details katulad ng nakikita ni Gerard de la Peña. We talk to that situation both in terms of the current situation and what we can expect given everything in the Philippines, our constraints, our limitations. I don't know if you're going to throw culture in there, but what do you take out of this one scene that Gerard has painted for us right now?
I mean, quite obviously, there is a real lack of imagination on how to do this. I work with the government of Bataan and have been helping them as much as I can, even if I'm here. And they came up for a system of distribution of 25 kilos of rice per household by getting people to text their name and their electric bill number, and that goes straight into an IT system where they then deliver the rice to the place. So anybody who says line up is crazy because that cannot be controlled. You cannot control a line. Why can you not say, all right, the people who will come today, I'll give you, your names all start with letter A, and then you can come. But to say line up, and expect social distancing and enforcement, we're asking for trouble. So this is clearly a lack of understanding of what the new reality is. People need to think ahead and try to imagine, okay, if we call people and tell them to come to land back, this is what's going to happen. We cannot expect people to behave in the same way if we are not changing the parameters for their behavior. So, in that case, I would say you should have numbers or a certain number of people who can go at 8 o'clock, a certain number at 10 o'clock, and a certain number at 12 o'clock. If they didn't do that, well, I'm sorry, parang katamaran na lang yan, ano? Parang, you're really asking for trouble. So I think people really need to imagine what the new reality is and how people must be nudged or prompted to behave in a certain way by creating systems with order. It cannot be all day. That means they still haven't learned.
Okay. Okay. Well, Dr. Susie Pineda-Mercado, once again, thank you. We hear the urgency, the exasperation, as well as we hear as well the messages of what can be done. We'd also like to thank Mayor Benjamin Magalong, although we apologize to him and his staff for the technical difficulties, JC Cosico, Gerard de la Peña, and of course, Bok Ed Lingao. Maraming salamat. Maraming salamat po for joining us, and we do hope we continue the conversations here on The Chiefs. Ako po si Robby Lampay of One News.
Ako rin po si Ed Lingao ng News 5. And we'll see you again tomorrow.